Okay.
Yeah, I'll still kick it off.
Right.
Okay, so it looks like we're streaming live on YouTube, so we'll get started. Good morning, everyone, and welcome to today's media briefing. It is Tuesday, August 25th. Today, we will hear from Acting Medical Officer of Health, Dr. Hsiu-Li Wang, with an update from Public Health, and I will be providing you with an update about enforcement. So we'll get started with Dr. Hsiu-Li Wang. Go ahead, Hsiu-Li.
Good morning, everyone. We have seen a slight increase in the average number of new cases reported per week compared to when we experienced the lowest number of new cases per week a couple of weeks ago. This is what we thought we might see with our community entering stage 3 and increased numbers of people out and about. Overall, the status of COVID-19 remains relatively stable. As of this morning's dashboard, we have 40 active cases. A total of 59,974 tests have been performed in the region, with positive results for approximately 2.4% of all tests. There are currently no outbreaks declared in long-term care and retirement homes, other congregate settings, or workplaces. Earlier this summer, the Ministry of Health developed a new custom-built COVID-19 data system. This system will streamline processes for case and contact management, as well as data reporting. Health units have been moving over to the new system throughout the summer, and our scheduled migration was last week. The change impacted our publicly reported dashboard updates on Friday and Monday because the infrastructure needed to be rebuilt to connect with the new data system. We are now using a slightly different definition for reporting cases. Previously, we had reported all cases where we were the health unit responsible for case management. Moving forward, we will be reporting cases where we are the diagnosing health unit based on their primary address or the address on their health card, even though the case management may be completed by another health unit. This was done to align with the province. This has led to an overall increase of 4 cases overall, attributable to Region of Waterloo. We have also performed a large data review during this transition phase. So, for example, the symptom onset date epicurve has been renamed episode date to align with the term used by Public Health Ontario. Other changes include switching to gender rather than sex, as the new data system allows the client to report their gender. And you will also notice that the cases by age group have been broken down further for under 20-year-old people and over 80-year-old people. So the new age groups are 9 and under, 10 to 19, 80 to 89, and 90 and older. We are continuing to work closely with our local school board partners to support them in implementing the Ministry of Education's return to school plan. I appreciate that making the decision to return or not to in-class learning was not easy for many families. There is no wrong decision, only the decision that is best for your family. We have learned that we will be funded to have approximately 20 new public health nurses, as outlined in the province's plan. We are awaiting more information about these positions, but at this point in time, we have that estimate. So we are moving as quickly as we can to recruit these new nurses. These nurses will be involved in things like assisting schools with infection prevention and control, case and contact management, outbreak management, and supporting the communication and engagement with parents and with our healthcare partners. As with any place where people gather, we expect that we will have COVID-19 cases detected. But all the measures that the schools are diligently putting in place will help limit and control the spread of COVID-19. These measures include screening for symptoms at home for all staff and students before they go to school each and every day. If you have any symptoms, stay home. The prompt isolation of staff and students if they develop symptoms, including if symptoms develop while at school. Physical distancing to the extent possible, increased hand hygiene for staff and students, enhanced cleaning of high-touch surfaces, cohorting students into groups. This limits the number of staff and students your child has close contact with. Your child may be in more than one cohort, but cohorts are still a useful measure because they help us to identify contacts and limit the spread of COVID-19 if a positive case is identified. Face coverings are required for students in grade 4 and up, but are strongly encouraged for all students. These measures are layered together to limit and control the spread of COVID-19 in school settings. In closing, keeping schools open safely will be facilitated by low rates of community transmission. Everyone, therefore, has a part to play to keep community transmission as low as possible. We will be living in a pandemic situation for quite some time, but we will have the best chance of keeping our society as open as we can if we make the recommended public health practices a part of our daily lives. Let's continue to practice physical distancing with anyone outside of our social circle or bubble. Wear a face covering in enclosed public spaces or on transit. Wash your hands often. Stay home and seek testing when we develop symptoms. Following these measures will help keep active cases in our community low and allow for economic recovery and reopening to be maintained. Together, we have been and are continuing to make a difference. Thank you for your efforts.
Thank you, Hsiu-Li. And I'll also thank Joanna for pointing out that today is August 18th, not the 25th. I've also lost track of my days during this pandemic, I guess. So I'll give you an update about enforcement. So just a heads up that now that we're moving to doing a public health briefing as opposed to the full region, we're also going to do the same with our enforcement numbers that we update you on. So instead of providing consolidated data from the other enforcement agencies, we'll be focusing on public health activity, but I will also gather any sort of data around the face covering bylaws so that you have that information as well. Just so you know, municipalities and police continue to monitor and respond to the Reopening of Ontario Act where they have jurisdiction. We have noticed a trend where things are starting to plateau and even go down in terms of these types of calls, which is a good thing. Also, enforcement agencies continue to collect and submit their enforcement data to the Solicitor General's office on a weekly basis, so you can still get this information from the individual agencies. So moving to the public health activity for the last week, August 10th to 16th, we had a total of 32 complaints, 3 of which required us to do site visit, and the other 29 were education and follow-up with the individuals. In terms of the face covering bylaw, we had 36 inquiries in total, of which for all of those we provided education and follow-up. We did not have to issue tickets in any of these areas. So that is the enforcement update that I have for you. We'll now turn it over to each of you for your questions, and we'll start with Joanna from the record. Go ahead, Joanna.
Thank you. Just a few questions about the nurses first. Are those dedicated to helping with the schools, and will they actually be physically in the schools?
Thank you for your question. So there are additional resources to help us really help with the school reopening, and if that starts to contribute to less work over time, then help with other aspects of what we do to improve student health. So we are getting approximately 20 nurses. We have roughly 200-ish schools. So you can see the ratio is about 1 nurse for approximately 10 schools. So the nurses aren't going to be able to be stationed in the schools per se, but for sure, they will be going out there to various schools, and they will be in contact, with their schools. Likely a nurse would have a group of schools. So, and the types of things that I listed are the types of things that are obviously going to be focusing on in terms of school reopening. But as time goes on, if there are other priority needs in school or children's populations, then they could be redeployed as needed to those areas, to those other areas. We're also awaiting more information from the ministry on exactly what they expect in terms of how we'll use what they'll be funded for. So we're waiting some more details, but we've already started to do the planning because we know that the principle is to allow these nurses to better support the reopening of schools, as well as overall, the health of school children.
And does it make you feel a bit better to have this additional resource as schools?
Definitely. These are resources we wouldn't have otherwise had. We know with school reopening, there has been, and I'm sure there will continue to be questions, and it's better if we have additional resources to be able to make connections with individual schools, to be able to spend more time to try to respond to the needs of individual schools. So additional resources will definitely help us give more attention to the large number of schools that we have in our region than we would have otherwise been able to.
And you also mentioned for staff and students to stay home if they have symptoms, like any symptoms or ones in particular?
No, that's a great question. So the list of symptoms for COVID has been evolving, as you may know, since the beginning. And the list is quite long now for any potential symptom related to COVID. So what we do know is that the Ministry of Health is in the process of preparing updated guidance, to help schools, public health units identify the key symptoms that parents, staff should be looking for, et cetera. So that's supposed to come shortly. I don't have an exact date, but that's going to help us be in line with sort of the latest evidence regarding the types of symptoms. But in general, what we say, Joanna, is that if you have any symptoms, you think you're starting to get sick, you should stay at home because you could have other infectious diseases that are transmissible as well, in addition to COVID. especially as we go into the fall. We know that there's seasonal circulation of other viruses. So it's a good measure in general to not go to school or go to work if you have any symptoms that are, not your normal symptoms. If you have chronic illness, for example, and you think you may be getting sick, don't. We used to, in our culture, we used to try to, you know, be strong, and so to speak, quote unquote, and go to work or go to school even if we were not feeling well. We need to really change our mindset as we live with COVID, that it's better for us, it's better for all of our community if we actually do not try to tough it through. If we, on the other hand, have a low bar for deciding, no, you know what, we're not going to go to work, we're not going to go to school, because we could have something and could spread it to others. So if we have any potential concern about that, we should stay at home. We should seek testing and stay at home.
And can I ask one more question?
Sure.
Yep.
Sure.
And you mentioned at the top about the increase in cases.
Yes.
Is that something people should be concerned about? Or are we going to just keep going up and up?
That's the key thing that we need to watch for. So we did expect some increase in the numbers because of the reopening. And I think all of us can see there's just more and more people out there, right, interacting with each other. And that's something we're going to normally see. But the key will be to see whether or not this continues to go up or if it remains relatively stable. And also, making sure that our testing volumes stay relatively stable as well, because then we can, watch for whether we are getting increases in the number of cases for the number of tests we're doing or not. So that will be an important thing to watch as well. But overall, I think what it shows us is that, we expected this to happen, but we need to do everything that we can. All of us individually do our best to keep to those public health practices, because we have seen how much of an impact we as a community can make when we all practice those measures. We can really keep the rates as low as possible. And when we keep community rates low, we decrease the chances of outbreaks in settings where there's lots of people, like long-term care homes, as well as school settings, for instance. So we all have a part to play to keep our transmission rates low, so we can continue to keep as many settings opened as possible.
Okay, thank you.
Thanks.
Thanks, Joanna. We'll move on to Nicole from CTV. Go ahead, Nicole.
Hi, Nicole.
Morning. Dr. Wong, what are your thoughts on the mandatory masks for all school-age children, including kindergarten to grade 3, unanimously approved by the public board last night? Would you recommend that the Catholic board follow suit?
As I mentioned, I strongly encourage that children in all grades be masked. The ministry has set a policy requirement for grades 4 and up. The district board has made it a requirement for all grades. Each board will have to decide what is best for them, but I strongly encourage it.
What are you recommending for COVID-19 outbreak protocols at schools? A lot of parents are wondering what will happen, how will they be notified, will a class shut down, or will the whole entire school shut down? Are you able to provide any parents with any guidance in regards to this?
And we understand that's definitely the types of questions that parents and teachers have right now. There is a guidance document that's supposed to come very shortly. I'm hoping in the next few days, that provides the latest provincial guidance with respect to outbreak management. So, public health is used to dealing with outbreaks. So there are basic principles that I'm sure will stay the same. But for school environments, we really want to hear from the province, what's the latest evidence, what's the latest guidance, so that we can all act across the province with that information in mind. And as soon as we get that information, we will be passing it on to the school boards. We will be reviewing it ourselves, and we'll be providing an update about that. I know parents have been asking. It's really, these questions are really important. So those are great questions, but we're just awaiting very shortly the latest guidance on that.
What is your thoughts and guidelines in regards to the classroom sizes? That's been a very topical issue. And a lot of parents are concerned amongst elementary school age children that not having the cap of 15 per class is worrisome.
Yeah, so what we understand is the province has, consulted with a number of experts, including sick kids, about what's the best guidance right now for schools, given our current state of knowledge about COVID. As you may be aware, their assessment was that for younger children, infection and transmission is likely lower. They wanted to, they've said that it's important to have physical distancing, and that a distance of about 1 meter or 3 feet in those types of younger group settings, may be an appropriate balance when you take into account all the factors that you have to balance in a school environment. So there's safety, there's physical development, mental development, there's feasibility. So, given that, what the ministry has said is that they want school boards to try to put in place as much physical distancing as possible. So we've been in conversations with them, and we are working with them to try to put in place those recommended measures, such as a minimum of a meter between students in those lower grades. And the other thing to remember is that it's a plan that talks about a layering of multiple measures. So, you have screening, you have cohorting, you have increased hand hygiene, you have increased environmental cleaning, and you have masking. So it's a multi-layered approach, and and distancing as much as possible is one of the factors. And so we're working with the school boards to implement as much as possible distancing in all grades.
Can I ask one more question?
Sure.
Are you going to be doing a walkthrough, like your public health inspectors and whatnot, through the schools? And if you feel they're not ready to go come September 8th, will it be you, public health, saying you guys aren't ready and please delay the start of school? How is that going to work?
Thanks for the question. Yeah, so we are planning to do physical visits. Obviously, we don't yet have the 20 nurses, and there are, roughly 200 schools. So we're going to be doing that in a staged process, obviously. And we're going to be working with the school boards to identify, where we would start to do the walkthroughs. We've been working with them, but they've been working 7 days a week. They've been working all the time, nonstop, to try to integrate all this new guidance, and sometimes changing guidance. And so they've been working really hard, and they've been keeping us updated. And we have a long-standing relationship or relationships with these boards. So, they have asked us questions about setups and things like that, and we've been providing assistance where we can. And so, they, by and large, are putting in place the measures. And if they haven't yet, they should be in place for school opening. And so these visits will be something that will be an added measure that we'll do to, assist them further in making sure that the things that they've planned and put in place look good to us too. But we won't, as I mentioned, we won't be able to do most schools before or only probably a small number of schools before school starts. So, we're speaking with them as we go so that we know if there are problem areas, we can identify and work on those as soon as we can and discuss those. They can send us pictures, they can send us video, right? So the actual in-person thing is going to be an adjunct, but a lot of the work is currently happening right now to make sure that those settings are ready for students when they return.
Thank you, Nicole. We'll move on to Kate from CBC. Go ahead, Kate.
Hi, Kate.
Hi, good morning. Thanks, everyone. I keep hearing like almost weekly, we're waiting for guidance from the province. We're waiting for the province to tell us stuff. And I'm wondering if that is frustrating for yourself and for staff to have to wait for all this stuff when people obviously have questions right away. And if it wouldn't have just been simpler to come up with like made in Waterloo region fixes.
I think that's a fair question. I think we have to look at, what's the best use of our time based on the resources that we have. So the province has access to has access to command table experts. Has brought together, experts from across the province, experts in fields like children's development, and other areas. So we don't have those types of resources. And, for us to go out and try to develop our own guidelines without knowing what others would do necessarily, it's probably not the best use of our time. And we have other things that we've been responding to. We have been continuing to work with workplaces, for example, on reopening and childcare centers that have been opened. And, every time, there's a potential child that may have something in a childcare, we are consulted on that. So there's a lot of things that we're doing where we think that's really the best use of our resources at this time, while the expert bodies are putting together the guidance. We understand that, guidance is not coming as quickly as maybe we all hope for. But whenever I speak with the provincial officials or I have a chance to hear what they say, they are working extremely hard and they are working around the clock, to try to get out the best guidance that they can in as short a time as they can. And they also want to make sure that they get it right. So I would say that I understand the frustration, but I think when it comes to important guidance like this, that we want to make sure, A, health units have the best evidence and latest evidence for, and B, we want to ensure that there isn't confusion and concern that's created when there's perhaps different guidance that's released by different health units. I think, waiting for some of the key guidance that will really set the high level parameters, that's probably the best thing to do. At the same time, we know that, if there's a pressing issue that affects us locally in a way that doesn't affect the rest of the province, if we need to act, we will act.
I know we've seen Toronto Public Health suggest smaller class sizes, and that got rejected by the ministry. But I'm wondering if Waterloo Region's Public Health has made any recommendations to the local school boards that go above and beyond what the ministry has already recommended.
Well, what we're doing right now is helping the school boards to implement what's required by the ministry guidance, which is already a series of measures, right? A multitude of measures. And so, that's sort of the foundation. Toronto Public Health did say that they support the ministry guidance. They are generally supportive of it. They've put in place a few additional recommendations, including the one you mentioned. But I think at the same time, what we have to be cognizant of is the feasibility of any recommendations that we would put forward. The guidance that has been developed by the ministry, they've told us it takes into account the most recent state of the evidence as presented to them by the experts, and it is a suite of measures. We know that putting in place the guidance that has been put out already by the ministry will already have a significant impact on reducing the potential for spread, when we see cases, and controlling outbreaks, as quickly as we can. So there will already be positive effects if those types of measures can be put in place. Certainly, we need to monitor the impact of these interventions. We need to see what happens in our school environments. And if there are circumstances that arise for which we feel there needs to be additional measures, we'll certainly be considering those.
And I just want to touch on the public health nurses
Yes.
and at the 20. What are the chances they can actually be hired by September 8th? Because I would think that the hiring process is more than 3 weeks.
Mm. Yeah. So yeah, definitely we have to find them, hire them, train them, etc. So it's going to take some time, right? So we are in the process of working as quickly as we can to see what public health nurses we can reallocate on a shorter term basis to start some of this work. So we have a lot of nurses on the lines, phone lines. We have a lot of nurses providing support to other settings, childcare, for instance. And so, they're busy, but at the same time, we know school reopening is an important thing. And we're going to have additional resources that are going to come, from these new recruitments. And so we just have to find a way to start to provide support to the school settings in a way that also balances our requirements or our needs to provide support to other settings. But I would say that just a short while ago we didn't even know we would have these nurses, and so or we heard the announcement, but we had no idea how many would be estimated for our region. So the fact that we have 20, that's a good thing. Let's go from there. Let's try to hire them as quickly as we can, train them up, and provide as much support as we can to the schools as soon as we can.
Great, thank you very much. I'll leave it there for now.
Thanks, Kate. We'll move on to Damon from Woolwich Observer. Go ahead, Damon.
Hello. My first question is for Dr. Wong. Guidance for bus drivers has been pretty limited during this whole reopening and return to school. What recommendations do you have to drivers to ensure their safety?
Well, thanks for the question, Damon. So worker safety is actually not under public health. It's under the Ministry of Education, the Ministry of Labor. So those types of guidance would be going to folks in health and safety, for example, at the school boards, and then they will be providing the guidance to the actual staff. So I would probably refer you back to the school boards for that question.
Okay, and there was a follow-up, but I don't think you'll be able to answer it then. Do you think drivers should be able to refuse ridership to a child that may appear symptomatic?
Yeah, that's a health and safety question and policy question for the school boards.
Okay, understandable. That's all my questions. Thanks.
Thanks, Damon. And we'll go to Ben at 570. Go ahead, Ben.
Hi, Ben.
Hey, how are you?
Good, Thanks.
Sorry, I'm just pulling up my questions here. Okay.
Sure.
So my first question is kind of, well, I'll just get into it. We've seen stable active cases for the past week, then trending upward, obviously. Back at the, you got more paranoid, trying to stick to public health measures. But obviously, we have to deal with COVID fatigue now. And it seems that is more and more prevalent, and people are less careful, and people are getting out more and more. Are you worried that we're going to see the curve pick up in the coming weeks like we saw at the beginning of the pandemic?
That's certainly always a risk, and that's certainly something I'm always worried about, actually, because we've seen that, cases can rise quickly. And we've seen that in some other jurisdictions in Canada where they had relatively good control for a while, like out in BC or Alberta. So something that can definitely happen here. So, the best thing for us to remember is that we largely control what happens going forward, we as a community. So, if we continue to practice those measures, we will have the best chances of being able to keep our rates relatively low and stable, and maybe even continue to reduce them over time. I understand the issue of fatigue. And, I don't have any magical solutions, but I know that when it becomes part of our daily routine to put in place those practices, it becomes easier for us to just do them without thinking. And so we have to what I'm encouraging everyone to do, if they haven't already done this, is to think about those measures of physical distancing, masking, staying at home if you have any signs that you could be getting ill, getting tested if you think you could be getting ill. If we take those foundational measures and we just assume that we will need to continue to employ those measures, and that by doing that, we have a really, if we all do that, or a large number of us do that, we're going to have a very significant impact on all of our community and what's going to be able to remain opened or opened as much as it is. So I think by and large, people want to do the right thing, and they're trying to do the right thing. Sometimes, understandably, sometimes people feel that if case numbers go down, then there's much less of a risk. What I'd like to just let everyone know is that, yes, it's really good when our case numbers are low, but with COVID, as we've seen, they can quickly rise again. So that is why it's important for us not to let up those measures. We've seen those are the types of when people let up the measures, when they gather in large groups, and they don't keep to their smaller circles, when they don't adhere to physical distancing, when they think it's okay to, just not practice those measures, that has led to increases in surges in other parts of the province that have really good, systems in place for detecting cases, contact tracing cases. We do here as well. But I think it just shows the extent to which the members of our community have an impact on how the rates go. And so I won't belabor it, but just to say that all I can say is this is something that can rise quickly again. So we have to continue with our measures. We have to continue to be mindful, of the impact if we let up those measures.
Right. And this, my second question is actually from a listener who tweeted at me, and this might again be school board protocol, so just let me know if you can't answer it. But they were wondering what the protocol is going to be if a child is showing symptoms and they chose, or the parent chose, not to keep them at home. Will they be like instructed to go for testing? Would there be testing on site at schools, or is that kind of not decided yet?
Well, generally, if you have a child that develops symptoms, the process would be to isolate the child in a school setting until they can be picked up by their parents, for example. And then, they would be given advice to go get tested. We would work in public health to facilitate the testing by our healthcare partners who do the testing. And we would provide advice to that family about what to do with that child in the meantime. And of course, we would take a look at potential exposures in the school setting. Cases that appear in the school setting don't necessarily originate in the school setting. So we'll have to do an investigation to see whether or not there is a potential transmission that's occurred in the schools. And then we'll go from there. So a lot of the things are not black and white, or there's not a preset algorithm, because it will depend on the investigative skills and information that are obtained, by, for example, our public health nurses who are doing case investigation and contact follow-up. So, what we need to be ready to do is to do that as quickly as we can. And when we have more specific guidance after we, receive more updated guidance from the province, we'll be able to provide more of that information that goes into more details. But the general principle is you would try to, reduce or cease the exposures of that child to other people in the school, and then you would manage that as a potential case that needs to be clinically assessed, and you would also assess the potential contacts in that school environment. And then you would recommend measures that are commensurate with the potential risk that you think may have occurred in that situation. So hopefully that gives a little bit of an idea, but we'll have more specific guidance that will come out. But part of it will always depend on what we assess in order to inform what the next appropriate best step would be.
Right. And with those recommendations, are those going to be sort of binding recommendations, or if the parent brought that same child back the very next day, would they just have to be sitting in isolation and then repeat the recommendations to the parent?
Yeah, I don't think generally children, if they don't have COVID, the recommendation is that they should come back 24 hours after they no longer have symptoms. So, there would be a certain, at least 24 hours where they wouldn't be back in the school environment. And when they come back, they would need to be asymptomatic. So they wouldn't be coming back if they continue to have symptoms and we didn't know what they would be, or else they would be sent home. So,
right. Okay. So they wouldn't
yeah.
be allowed to come back. They would be sent home.
Mhm.
Okay. Thank you. That's all my questions.
Okay.
Thanks, Ben. So we've made it through the list once. Do we have any follow-up questions? Kate, thank you. Go ahead.
Thank you. Dr. Wong, we were talking to Dr. Hsiu-Li maybe last week about increased testing centers. And I was wondering if you could just kind of provide a bit of an update about the conversations that are happening about whether the region is going to be adding more testing centers for fall/winter. Yeah,
that's a great question, Kate. Unfortunately, I'm not the best person to respond because that's being led by the assessment centers. And I think a good person to ask would be Lee Fairclough, because she's the lead for the hospitals for that topic, assessment centers and testing in the fall. Dr. Hsiu-Li is an important player. Him and his team of physicians have been really helping with the testing. The clinic that his team of healthcare practitioners staffs is an important part of the overall number of testing sites we have. So yeah, he's a good resource, but for an overall view of the situations, probably Lee Fairclough.
And I just wanted to ask as well whether or not public health has received any information about flu shots this year and whether they might be coming in a little bit earlier to maybe encourage more people to get them before there is sort of the flu and cold season?
Yeah, that's a good question. So every year when the flu shots come in, it's really dependent on when Canada can get them and then when the provinces can get their share. So there isn't really a mechanism to significantly like increase when they come in. What I mean is significantly bring them in earlier than we would have otherwise scheduled them to come in. But I do know that that issue is an important issue for both the feds and the province, and they are doing everything they can to try to get in the shots as soon as they can, and then try to make sure there's enough shots. Usually we don't have a problem with that because we don't necessarily, well, we don't have everyone uptake the vaccine. But this year there's definitely going to be a push for everyone that we can get immunized to be immunized. So they're thinking about things like making sure there's sufficient amounts of vaccine, and public health will likely, as traditionally we have been, involved in this. Now, fortunately, it's not just public health that can deliver the vaccine. In fact, in our community, we have a lot of pharmacies as well as primary care practices where people normally get their vaccine. We're going to continue to encourage that. But of course, we're going to hold clinics where there may be some gaps. For example, in the past, we've held clinics for younger children, like under the age of 5, because pharmacies couldn't vaccinate them. So we'll be trying to address those areas of need that aren't covered by our traditional providers. So there's definitely going to be a push for that, and it's definitely something we're gonna encourage people get in the fall, because that's a way to prevent an illness, help prevent an illness that could very much mimic COVID. But
Okay.
More details come out. We'll be providing them to you.
Awesome. Thank you.
Any other follow-up questions? Okay, I'm not seeing any hands up, so we will conclude today's media briefing, and we will see you back here next week, which will in fact be August 25th. Wish you all a good week, and we'll see you then. Take care.
Thank you.
Hey, Julie.